Hello, and welcome to Questions and Answers about Hidradenitis suppurativa, or HS disease. This is the first co-production between the Skin Centre for Dermatology here in Peterborough, Ontario, and HS Aware. My name is Michael Wiens, and I will be joined today by Dr. Melinda Gooderham. She's the director of the Skin Centre, and also my personal doctor. Other associated conditions, which I know you've said that there's a bunch.
Yeah, like with most systemic inflammatory conditions, we see other, what we call comorbidities, or other other conditions that people have along with their HS that can be related. And one thing that we are noticing with a lot of inflammatory conditions are psychiatric issues like depression and anxiety are more common in patients with HS than in the general population.
Well, why would that be? Is there a known reason?
Well, we're still trying to sort that out, but the idea of the systemic inflammation and some of the cytokines or
that's another big word.
Yes, the inflammatory molecules, so the inflammation signals coming out of your cells, they think may have an impact on the brain, leading to depression and anxiety. And then on top of that, you get a condition that's painful, keeps people from working, it may make them feel isolated, keep them at home, and altogether that's kind of a recipe for these...
It's a depressive cycle that really hard to get out of.
Yes. And further with the comorbidities, beyond the mental health issues that some patients with HS suffer from, there are a number of physical conditions that patients with HS may also have, such as metabolic syndrome, which includes diabetes, hypertension, high triglycerides, low HDL, which is the good cholesterol. Also, some patients suffer from arthritis, particularly of the spine. There can be inflammatory bowel disease, like Crohn's disease.
So really it can affect all parts.
HS is part of a systemic inflammatory condition, so you can have many other...
So when you say systemic, you literally mean all
there
over?
There is inflammation inside the body.
Okay, and it can manifest anywhere.
And it can affect any organ, really. What we call modifiable risk factors, things like obesity and smoking, are linked with HS. They don't cause HS, but they're linked with it. So we try to promote a healthy lifestyle, such as quitting smoking and trying to eat well, and if possible get good exercise. But as I mentioned, sometimes people do have arthritis and other conditions.
That's certainly one I know very well.
That might preclude that. But we, just like any sort of condition, living healthy is always recommended.
Thank you so much for agreeing to do this again, Dr. G.
Yeah, thanks. Anytime.
Hopefully there might be many more of these. We'll see.
For sure.
Thanks for tuning in. Bye-bye.